underutilized or under-researched? And also, how can we help? So as I moved from academia to industry, I realized that the wellness industry can play a major role in filling this key research gap. And we have a very unique window of understanding into what the consumers are looking for. And I'm so excited now that my role at OLLY here allows me to lean into that and fill this critical research gap. We're right now engaging in a lot of women's health clinical trials, trying to see how we can improve aging overall, but also just the whole lifespan, like the health and wellness journey of a woman as she progresses.
That is so key and interesting because if anybody's been listening to this podcast or others, we know that there is a dearth of information on women and women's health because we were not included in research until relatively recently. So that's wonderful that you're trying to fill those gaps. Can you talk a little bit about some specific areas that you're focused on?
Yeah, so it's quite, like I said, it's a little bit of the whole lifespan that we're looking at right now. We start early. We're looking at women's nutrition during different stages of their life. The one study that we have done very recently, just finished, was on menopause and what we can do to improve overall life quality in menopause. So that's a key area of research for us. But we're also looking at perimenopause, and we're also looking at like the teenage years, like what can we do that's helpful and supportive for women and where we can meet their key unmet needs.
Sure. And how are you doing that research in terms of, is this using biomarkers and that kind of data, or is it more subjective?
We're doing both. So these are full-on clinical trials. So we have a couple of clinical trials where we're looking at biomarkers. We have a couple where it's subjective questionnaires, but they are validated questionnaires. So they've been used extensively in the scientific literature for different types of evaluations in women. And so we're looking at that. To me, they're both sort of complementary to each other because you have the questionnaires where women are truly telling you how they feel about something. And then you have the biomarkers, which tells you the biological status of the women as they're exploring interventions and working through interventions. So I think they go hand in hand.
And are you also then providing interventions, i.e. supplements or any other products, to see how that can change that trajectory?
Absolutely. So the menopause trial, like I mentioned before, that one was an intervention trial. We had a supplement that we were looking at, and it's a supplement that has recently launched for us, and we were so excited with the results of that study. It's looking at acute effects that we see with the intervention. So it's over a period of time. You can obviously, there's a lot of products out there which support women's health into menopause. But what we found in the study was within days, we had some relief for women in that study. And that was super, super exciting to us.
Sure. And you're not talking about a prescription drug. You're talking about an over-the-counter supplement.
Absolutely. So all supplements are over-the-counter. We're not working with medicine. This is for your health and wellness, right? Like menopause is not a disease condition. So we're not looking to say, yeah, I mean, it's so important to know, right? Like menopause is something every woman who lives to the age is going to be in menopause at some point. Sure. So it happens to every woman, and we wanted to make this accessible. So if you go with the medicine route, obviously there's prescription, there's doctors, but this is something you can go into your Walmart, your Target, and just buy off the shelf.
And is that product that you just talked about on the market yet?
It is on the market. It's called Mellow Menopause, and it's launched last year.
And who is that indicated for, and what kinds of ingredients are in it? Not to give us your secret sauce, but just the kinds of things that are there.
No, I'm so glad you asked, because one of the big things that we do believe in is transparency and mellow menopause. I always say, if you don't know what you're taking, then don't take it. So it's a blend of 3 botanical ingredients, and it also has GABA, which is being explored right now, not just in the supplement space, but also by the NIH, who's looking at the effects of GABA. GABA is a neurotransmitter, is an inhibitory neurotransmitter, so it sort of quenches brain activity. And when you're having like hot flashes and all these things like night sweats, that's something that GABA can work on. And so we felt like this would be a very good combination with the ingredients that we have, the botanicals plus GABA together. And so we wanted to test it, and it worked really well. worked really well.
Let's talk a little bit, because I think that listeners might be surprised to hear that there were clinical trials on a supplement that's over the counter. Or maybe they thought that's what happens to all of them, but that's certainly not the case. So talk to us a little bit about the industry in general and what consumers should be understanding as they're looking at the what's increasingly, vast array of options.
Yeah, no, absolutely. I mean, there is a lot out there. So when consumers are looking for products, one thing that I always recommend is look for ingredients that are clinically studied, look for products that are clinically studied. And believe me, if someone does a study, they want to tell you about it. It's going to be on the product. It's going to be on every label that you see. So look for products that talk about the clinically studied ingredients in there. Ask if it's dosed right, because a lot of times the study may be at a different dose. The study may just be preclinical, by which I mean the study's only been done in sometimes mice, sometimes rats. It doesn't apply to humans. So ask if there's human clinical data on the studies.
And I'm going to stop you right there or interrupt if you don't mind. Who do you ask?
It's usually on the product website. So I think do the same type of due diligence as you would if you were going in for a medicine. You would ask for data, demand data. And I think that also then fuels more research going towards it, right? If you just hear from someone X works, or Y works, and you never look it up. I mean, now you have AI, you have Google, you have so many tools. Demand data. That's what I would say. Demand transparency.
Absolutely. And talk a little bit about the FDA process and how it may or may not pertain to these kinds of supplements and how you all deal with that.
Yeah, so there's a whole body of organizations that oversee supplements. So I read a lot, even it's on LinkedIn, it's on, it's news sometimes, supplements are unregulated. That is not the case. There is regulatory oversight. It is different from medicine. The trials that are required are also different, but every product that is launched, or every good product that is launched, is provided, like the FDA is provided the information about that product post-launch, and there is regulatory oversight. There is also FTC, which we are always looking at. There's another body which oversees supplementation, and there are advertising that goes behind supplementation. So it is not the wild, wild west. I think that is one of the biggest misconceptions. It almost seems like sometimes you see these articles or these responses from people, and it's like, oh, you can put anything in the market. That's not how it works. There's a whole regulatory oversight we have whole regulatory teams just doing product and ingredient evaluation. We have to ensure the product is safe. It has been tested for purity, potency, concentration. And those are things that every good supplement does and should be on the label. Like, you should be able to reach for a supplement and say, okay, was it tested? Was it third party tested? Is it safe? Like, those are things that are not, that's part of what a good supplement should be.
Well, and you're saying what a good supplement should do. So that suggests that there are some that are not as rigorous, some companies that are not as rigorous as yours. And so go back to the label if you don't mind. Could you be more specific about what someone should be looking at and looking for?
Now, in terms of the kind of testing that is required, look at the SFP, like look at the supplement fact panel, and it should state how much of each ingredient, each active, which is supporting the claim, makes the product. And that should tell you, and then you should be able to go find it. If it's not already on the label, you should be able to go find it and look at, for me, it's always PubMed, but the truth is you can now also look at Google and find that data.
Right. And you talked about third party, and that really tells you about the purity of the ingredients. So speak a little bit to that, if you would.
Yeah, so there are lots of different bodies that do third party testing, but most supplement companies work with external labs, and they test everything for ID, purity, and potency. And those are three critical things. So that's telling you that what you're seeing on your supplement fact panel is what you're getting, and is what the product has been tested for. That's part of just what's in the product. And then the claims that you're talking about, structure function claims, help support your body in this way or in that way. That has to be tested in clinical trials, and that's obviously done before the product even launches.
Sure. And we'll just get into the weeds just a little bit more and then we'll get out of them. And that is, you talked a little bit earlier about ingredients that have been proven to do X, Y, and Z. And so I've seen a number of companies that have shown that data on maybe 3 different ingredients, but they've never been put together. And I think the assumption is that if they've all been proven separately, that the combination is either more potent, more effective. Is that necessarily true? And is that something that a consumer should be wary of?
That's an excellent question, and that has been a big debate in the supplement space for a long while now. Usually, you need to have ingredients that are clinically tested, not the entire combination that needs to be clinically tested, and that's been the general idea. But like I was talking about menopause, for example, the ingredients themselves have been tested. They have like 5 or 6 different studies, and then we did the full product testing as well. So I think that's when I talk about transparency and the rigor of the science behind these things. That's what you should be looking at. And there's, again, clinically tested ingredients and clinically tested products. And both are there in the market right now. Like, I'll be honest about that. It depends on what your specific need is.
Sure. I love what you just said. I'm going to underline it. Clinically specific ingredients or clinically tested ingredients and clinically tested products are maybe 2 different things, meaning that the products are a group of ingredients. And so I think that that's really important. Okay, so we'll get out of the weeds a little bit and talk about, if you would, you lead strategic strategy for hormonal health products. Talk about, for a woman entering perimenopause who's experiencing all the changes, metabolic changes, mood shifts, sleep disruption, what would be your scientific-based action plan?
Yeah, so perimenopause is an interesting discussion, and I am so glad that you bring it up because it's also one of those need areas that I think even women are not always aware of.
Yes.
The way
until they've, maybe in retrospect, but not always when we're in the middle of it. Absolutely.
Always. I think that's increasingly what we find. It's almost like what is perimenopause, and so the way I always think about perimenopause is you book a vacation, you decide you're going to this island, and you get to the island. There's no Wi-Fi. That's menopause. Your estrogen is offline. But the journey to get to that island where your Wi-Fi is on and off is perimenopause. It's a long time. It's 7 to 11 years, and anywhere in that range, 4 to 11 years. And it's a time when women can actively do things to change the outcome as they get to menopause. So there's a lot of different things that I think women can do in terms of perimenopause support. There's obviously a slowdown in the metabolism. So there's anything you can do to up your metabolism at that time will serve you well later. Exercise, lifestyle interventions, basics, dietary changes, but also exercise, and even little things in that. So that's something that is, perimenopause is almost the perfect time to be looking into that.
Absolutely. There's been conversations about, quote, nutritional deficiencies and other kinds of maybe even elemental, deficiencies, or a need for supplements in that case. Can you talk a little bit about your thought process in terms of some of those very specific kinds of things?
Yeah, so at OLLY, we did create a supplement specifically for perimenopause that actually was launched after menopause, because we did realize like it's a more critical need for women, and supplements do have a role in this space. I never say don't look at other interventions. Exercise and diet is most critical at this time. But there are also supplements which can help you because you start to experience little things that maybe it's not enough if you're just exercising or if you're just, making dietary changes. Because a lot of women, because they have that metabolic slowdown, they start to eat less and less. And after a point, like you're under 1,000-calorie diet, like you're starving yourself. What are you doing? And so that's where supplements can actually help. You have protein supplements. You have we have a product called for perimenopause that we does support healthy metabolism during that time. There's also like other things, creatine, for example, it's all the rage right now. But that is something that women start to see a decline in. So if you can supplement that muscle health with something like creatine, I think that could be very helpful. So those are all ingredients or products that are available that could support you during that time.
Looking at the future of women's health, what emerging research or innovations are you most excited about going forward?
Yes, I think that's, we sort of touched on it at the beginning. One of the things that I think is coming up in a big way is gut health. And there's a lot that is happening. We are only starting to scratch the surface of gut health and the microbiome. And so I think that is a key area that is going to develop really fast. We are starting to understand your microbiome is not just your gut. It's also like all these other functions within your body. There's gut-brain connection. There's a gut-skin connection. There's vaginal health like we talked about. So there's so many things that the microbiome does. And I'm so excited about all the work that is being done in that space, both in academia. Like there's a lot of universities working on that, and OLLY is partnering with them in a big way. And also within industry. And I say that the health and wellness industry, but also within the pharmaceutical industry. I think collectively there is, I envision a huge growth in that space.
Absolutely. Where do you see it specifically with respect to women's health really having an impact?
Yeah, so for women's health, I think there are a couple of different things where menopause, perimenopause, definitely something where we can start to tap into it, because there is a microbiome shift as women hit 40 and then beyond. Even in postmenopause, there's a microbiome shift. In fact, I'd go so far as to say during the different life stages in a woman's life, you have a lot of microbial shifts that you're seeing. So starting to understand that, and what can we do better? Like how can we decode the microbiome of women who are maybe not having as many hot flashes, or not having as many night sweats, or not having 20% of women don't have any symptoms of menopause at all. And so could we perhaps decode that microbiome and learn something from that? Could we explore that further? There's also changes that we see in women who don't have, like earlier in life, right? UTIs. There are women who don't have any UTIs during their entire life, and about 60-70% of women do. So can we understand what those changes are, and can we then use them productively?
Oh, that's fascinating. That's a really good point. As someone who's, again, in this space, how would you advise women or inform women about, if they're using estrogen, for example, to manage their perimenopausal symptoms, or any other medications? What do they need to know about any potential interactions or synergies if they're going to select a supplement or a nutraceutical?
Yeah, I think the one thing to keep in mind is there is no one size fits all. And I think that's the biggest thing. And we see it in many different ways. Because sometimes you take a product, it works for you, you tell your friend, you tell your sister, it doesn't work for her. It's entirely possible, because the human body is so different for each one of you, literally everyone. The same things may or may not work for you. Like we see these in clinical trials. A product may work for 80% of the people, but there's 20% of the people it didn't work for. It's still an effective product. So you see that it's the same with exercise. A lot of people will live by yoga, and there's others who are like, if I don't do weights, my body doesn't change at all. That is entirely true. Like it's possible that happens, because the body responds differently. Everyone's body responds differently.
That's a really good point about, everybody's different and reacts differently. And then in terms of, again, looking at some of these options, people are increasingly on potentially estrogen to manage their hot flashes, or they might be on a GLP-1 or maybe a hypertensive drug. What do they need to know or think about before they start maybe an over-the-counter option as well?
Yeah, so I think one of the things is there's a little bit of a 5-10 year period where estrogen suddenly became the enemy. And it was like you should not be taking any hormone replacement therapy at all. It goes back to what I was talking about. It does not work maybe for some people, but for a lot of people, the earliest you start estrogen supplementation, actually it's the more helpful for you. It even as you age, like go past 60, an early supplementation with estrogen does help a lot of women in a lot of different ways. There's a lot of work being done on evaluating whether estrogen is even neuroprotective, because like I said before, Alzheimer's is more prevalent in women, but that happens after the age of 60. Why is that? Is it because estrogen is now basically offline? So I think you have to evaluate that. A lot of the products that are the dietary supplement products that are in the market, you could probably take it alongside estrogen if it is non-estrogenic in its effect. Menopause that we have launched is one such, like it does not have any estrogenic effects. We have not, I will be honest, we have not tested it alongside estrogen therapy, so we don't know if that would work, but mechanistically it makes sense. So I think it's exploring. There are other dietary supplements which do support estrogen levels in the body. And so maybe that's where you should be more cautious before you take it if you're on estrogen already. So I think it's a little bit of like, talk to your doctor, try to understand what you're doing. And if mechanistically something makes sense, then maybe approach it with caution. But you'd have to look for the studies.
Right. And then again, the internist in me is thinking also, just check the ingredients, make sure that it doesn't have an interaction with any prescription medications that you're taking as well.
Absolutely, absolutely.
What's been the most surprising finding in your research that changed how you think about women's health?
Yeah, I think there are two things that one obviously is menopause. We did that study. What we found in terms of the acute effects that we were seeing with that product was really, really surprising and very exciting for us. We're trying to follow up on it, do more work to understand how that even happened. And so we're super excited about that. The other thing that happened sort of earlier in my career was the effect of exercise overall on, and this is when there's a long period of gap. Like if you exercise early in life and then you have a long period where, life takes over, just kids, this work, you have a long gap period. People who used to exercise early in life still have an advantage in terms of brain aging, in terms of overall health, even when they come back after like a long period of time. It's been shown in animal models, it's been shown in human studies, and to me, the early intervention that exercise can be was just a fascinating finding, and how we could do something really to supplement everyone's life. Because, when you're a child, you have time.
That's true. That's true. One of my, it's not a pet peeve, but really focus is how we might counsel young kids, especially girls, about exercise early on for bone health, because you're banking bone until your 30s, and then you start going the other way. So and the exercise piece of it is so important, especially the strength training. You're talking about a lifestyle intervention. We talked a little bit about diet, and the third piece of the stool perhaps is sleep, right? That's another huge issue. And so talk a little bit as a neuroscientist about the importance of sleep and what folks might be able to do to help that, because anybody going through a hormonal transition, whether it's pregnancy or perimenopause or beyond, that seems to be a real Achilles heel for a lot of us.
Yeah, sleep is definitely one of the pillars, as I would say, of overall health and wellness, and how you can just do better for yourself. It does, and interestingly, hormones influence sleep as well. But for every stage in life, whether it's menstrual cycles, pregnancy, perimenopause, menopause, like sleep is one aspect that is always there. And there are different
or not,
things, or not, lack of, absolutely, lack of,
which is the problem.
Yeah. But there's a lot of data on what you can do to support sleep, just like getting off the screen. Like I have 2 teenage boys, and I always tell them, get off your screen, don't be on your screen before. But the truth is, I am equally on my screen before I start. So what can you do to filter out that blue light that you're getting like all the time, pretty much? There's ingredients out there that have good data, lutein, for instance, like which can support that. So that's something that we're always evaluating. But there's also, if you have transitions, abrupt transitions, you're jet lagged, or you're going to be traveling and you need to get into there's other ingredients that can really help you. Melatonin is one of them.
Sure. And we've done a number of episodes on that, so I'm going to refer my listeners to some of those. But since we have the benefit of having you here, talk a little bit about melatonin, the good, the bad, the not so good.
Yeah, so melatonin is again one of those. It's GLP-1 is going a little bit like that. I feel like right now, it's one of those that has been very provocative in the space.
Having a moment.
Always, this moment has been going on for like a few years now. I feel like, but melatonin is just one of those ingredients that has been so well studied. I would say, with a few exceptions, it's probably the most well studied of sleep support ingredients, and it has consistently shown good effects. There is obviously how much you need, right? Like, do you need 1 milligram? Do you need a 5 milligram, 10 milligram? So there's a whole
and
range.
What's the answer?
The answer is it depends, right? Like, there is no one size fits all. I always say start small, right? Like, start with a 1 milligram dose. Up to 3 milligrams is probably where you will end up. But there are some people who really struggle with that 1 to 3 milligram, and there is like go up to 10 milligrams if that's. It is a pretty safe ingredient, and it is a very effective ingredient. And so I am a huge proponent of melatonin.
And so melatonin is a hormone that helps us to kind of tell our body it's time to go to sleep. Talk a little bit more about how it works, and also, should you just be using it if you're having trouble falling asleep? Is it also useful for staying asleep? I'm really curious about it. Now I've got this expert here, so I'm going to ask you all my questions.
Yeah, no, so melatonin helps you fall asleep and stay asleep, but for a short period of time. Like, it's the typical time is like 3 to 4 hours, which is why I said the dosing depends, right? Like, and there's also delayed release melatonin, which lasts longer if you want to sleep up to like 6-7 hours. So you could do it. You could use it different ways. It is a hormone, and it's a hormone that spikes and then goes down, right? Like, as evening starts, you should start to see an increase. But we do in our day-to-day lives a lot of things that impairs that. We're, like I said, spending more time just even not even trying to get away from any kind of blue light. We this coffee, like, there's just things we do that sort of disrupts the normal sleep cycle. And a lot of people, when they're having coffee, they'll be like, no, it doesn't do anything. I can have coffee and fall asleep. I always say, like, do you truly know that? Have you tried not having the coffee and then seeing, right? Like, and you will see the difference. It is hard for me to imagine. Maybe there's like 1% of people who have no impact of caffeine, but that's not the majority of people. And so we're doing all these things that actively impair our ability to produce melatonin naturally in the body. And so if you're going to do that, then you need support, you need help, and melatonin is available.
Okay. And any hangover effects that you've recognized?
I don't think it's a hangover effect, but there is, for some people, there are especially at high doses, like if you take too much of it, it's possible that they don't, I don't know if it's a hangover effect, but there can be some potential downside to taking melatonin.
Well, I would say that, I guess the question is, if you're taking it too close to when you have to wake up, maybe that's...
Or if you really have to interrupt, right? Like, if you take melatonin, you plan to sleep for whatever, like you take it at 5 p.m. and you decided you're going to sleep till 7 a.m. in the morning, and then for some reason you wake up, right? Somebody wakes you up, or you have to travel and you're taking it early. If you disrupt that cycle, now you've got your body with melatonin and you've woken up, so you've done something that is not how it was supposed to work, and then you might feel like
so you really need to be planful.
Yeah,
sure. Well, that makes a lot of sense. Well, it has been such a pleasure having you, but before I let you go, what is it that I didn't ask that you think is important for our listeners to know?
I think you've asked a lot of great questions. But a couple things is that I always like to talk about is just exercise. How much that can do for you, and also exercise is not always what we think it is, right? Like, it doesn't have to be hard. For a lot of subjects earlier in my career working with Alzheimer's, just that the squeeze ball was exercise, and that it can actually help you. It depends on where you are in your life and in your journey. So that to me is one thing. That is something everybody can do. The other thing is to build meaningful connections, because we have a lot of physical enrichment, but also mental enrichment. And those those connections that you build in life with people will help you, just mental enrichment. And there's so much value to that. So those are my two critical pillars that I always think women can lean into.
Those are such great reminders that not everything comes from a bottle, and and it's really usually multiple factors. And the ones that you just talked about, exercise, community, are so important, and they really don't cost anything, other than maybe a little bit of time. So thank you for those reminders. Well, Dr. Shikha Snigdha, thank you so much for being with us today. I know I learned a lot, and I know that our listeners will have as well. Thank you.
Thank you, Dr. Krockover. It was a pleasure to be here.
I want to thank Dr. Shikha Snigdha for such a thoughtful and science-grounded conversation. Today's episode really highlighted how supplements and nutraceuticals can play a role in women's health, especially during perimenopause and menopause, when they're built on clinical evidence, transparency, and realistic expectations. We talked about what to look for on labels, why clinical trials matter even in the over-the-counter space, and how supplements fit alongside, not in place of, foundational pillars like exercise, sleep, nutrition, and social connection. As always, this podcast is meant to inform and educate, not provide medical advice. Everyone's body is different, so if you're considering supplements, especially alongside prescription medications or hormone therapy, be sure to talk with your clinician about what's right for you. If you found this episode helpful, please subscribe, leave a review, and share it with someone navigating these same questions. And check out our website at beyondthepapergown.com for more information and episodes, and to sign up for our newsletter. Until next time, take good care. This episode was produced by Patrick Shambayati and me, and our associate producer is Kyla McMillian.